Today I'm going to demonstrate how to place and remove a dental dam on the lower right quadrant from tooth number 4-1 to 4-7. So the first thing we always want to do is inform your client of the procedure. So you would ask the client whether they've had the dental dam before or not, and if they have, you can just do a quick review of what it is. If they have not, you want to emphasize some main points being ensuring client comfort by telling them why we use it, and the reasons are that it prevents debris from falling to the back of their throat, but they can still breathe through their nose and swallow normally throughout. So just ensure they're okay with that, and then always receive client consent before proceeding. Once you receive client consent, check your ergonomics, make sure you're positioned, your client and equipment for the area that you are working on. You must also remember to use a fulcrum when handling a working instrument and use your mirror skills throughout your procedure. Okay, the first thing we're going to do when you're in the operator chair is you're going to examine the treatment area. So we ask that you use a mirror. So retract the area. You can use direct vision in this area specifically. What you're examining the area for is for any misaligned teeth, any missing teeth, any tight contacts. There is the option, if you like, you may check contacts. If you go in and see a mouth that has heavily restored area, you might want to just check the contacts with a piece of floss and make sure you're aware of perhaps some loose areas or tight areas that you may come across through your application. Those contacts all are free of any voids. So I will begin by punching my dental dam. So the operator has asked me to punch from the 4-7 to the 4-1, 4-7 being the anchor tooth. So from that, I know that my dental dam needs to be positioned in, over the lower teeth basically. So as per the instruction in the class, if it's a lower arch, we will use your thumb, half a thumb length from the bottom of your dental dam, or your distance on your punch from here to here would be about half a thumb. Okay, so the first punch will be at center using punch hole number 1, representing your central incisor. The 4-1, 4 punch, 4-3, 4-4, and 4-5. You will skip hole number 2 and go to hole number 3. And what I'm doing that you cannot see on the camera, because it's more of an intraoral camera, is trying to make the arch into a curve similar to what a hockey stick would look like. Okay, I'm on 4-6, so I'm using hole number 4. And then the key punch hole, you leave a little extra space and punch that. So what I have, we'll see if I can get this on the camera, something like that. Okay, so the distance between each hole is the distance on your key punch pad between the holes. So that's a good representation of what we're looking for. Okay, so you have to watch your hole spacing, make sure your arch alignment is okay, and then you landmark from the edge of your dental dam. Okay, your next step is to select and place a clamp. So because it's the 4-7, I'm going to choose the 14. Okay, and we have to ensure that there's a safety floss on your bow. Okay, so I have the 14 clamp, the safety floss. What you do with the floss is fold it in half. Okay, where am I? There we are. Feed it under. Go. Fold it up. I know this is difficult to see. Run your fingers through. Sorry. And that's what your safety floss will look like on your bow. So you would bring it over to the buckle aspect. Okay. Once it's ready to roll, you want to ensure that local anesthesia has taken effect. Okay, so you are going to then just touch the tissue of the 4-6, we'll say we're working on. Okay. The client may feel pressure, but should not feel any pinching. So if they feel basically the explorer touching the tissue, you would ask your operator to administer more anesthesia. We're assuming that this anesthesia is in effect, so we're ready to place the clamp. Okay, so you would take your forceps, place the beaks, wrap this safety floss onto your pinky of the finger, same hand holding the forceps. Okay, with your mirror you retract the cheek. Just going to get that floss on the buckle aspect. Try to seat the clamp one side going over to the other. I typically would start on the lingual and slide over the buckle. You want to be over the height of contour. There we go. And slowly release. Okay. Check the stability of your clamp by just rocking it on either side. You can do that at the 11 o'clock position or the 9 o'clock position as long as you're ensuring stability. Okay, if it was unstable, of course, you would change your clamp and try something else that may. So you also want to, at this point, use your mouth mirror to ensure that there's no tissue impingement with the prongs of your clamp. And it looks okay. It's okay to be touching the tissue, but not into the tissue. Yeah, so we now are ready to, okay, the cut dental dam that I had shown you before, I'm going to go ahead and use that. Kind of place it over the area with my cotton pliers. There we go. Feed your cotton pliers through the last hole that you punched. Retrieve the floss attached to the gum. Oh, let me try that again. Okay, basically lie it over top so that you can orientate yourself. Once it's there, stretch your, try to go behind the bow of the clamp first. Once you beat it with your fingers on either side of the wings. Okay, once you feel that's pretty secure over your bow, use your dental frame of your dam. With this floss, I tie it around the frame to secure that. In case it pops off, it would avoid aspiration. Okay, I have a much better view now of that area. If you want to go ahead and attach the other prongs, you sure can. It's nice to leave it a little bit loose so that you can have a little bit of stretch with your dental dam. This clamp in particular has wings on it. It is a winged clamp, so please ensure that your dental dam is around the entire wing. Okay, and if you're struggling, you can use a PFI to help you out. Okay, from there you would stretch the dental dam over the teeth that you isolated. You can start anteriorly or posteriorly. It's completely up to you, but you just work in small segments at a time. Okay, so you have to stretch it down. One thing some people choose to do is put lubricant on the underside of the dental dam to help it slip through. I find that it may make it too slippery. It might work okay on a mannequin, but when it gets onto a client, it's too much lubrication then, so I skip that step. Okay, so I'm just going to start flossing my interproximal areas to get the dam through. Sometimes you just need to start flossing and then it gets through your contacts. You can floss a couple times through each one, and it's just a tooth by tooth process. Okay, the first bicuspid looks like it's exposed. Okay, so what I'm doing now that they're isolated is I'm trying to floss the dam below the contacts into the sulcus. That is the beginning of your inverting stage. So you want the inversion to occur on the mesial and distal aspects. Most of the time, if you floss into the sulcus, you will get that automatically with floss, which is great. You may go up and down if you have open contacts. If you have a tight contact, the method is to up and down on either side and then pull the floss through the buccal. Okay. We are then going to place and secure the floss ligature, and it's important to get below the cingulum. So what we want to do if you're placing a floss ligature is to tie your piece of floss into a slip knot. Okay, so I'm just going to get a new piece of floss so this one doesn't break. If you reuse the same piece of floss, this happens to me before, it will break quite easily. So we have a nice fresh piece of wax floss. So again, you fold it in half and make a slip knot similar to how you would tie a balloon. So you put it in a round circle, put your end through that circle, pull it through, and the idea of this type of knot is that you may take the sides and tighten or loosen as need be. Okay, so the easiest way to do this is just to floss it on the mesial and distal of that and most anterior tooth. I'm pulling it down. You tighten it just till it touches the facial. You would then need your PFI to get the floss under the cingulum. So the idea of this is that you're using the shoe part of your PFI, fulcruming, and as you have a strong fulcrum, you press against the lingual surface of the foreone, and you'll see the floss migrate down under the cingulum. This may take a few attempts to get. Once you feel the floss slip below the cingulum, put down your mirror, maintain with your PFI, keeping the floss underneath the cingulum. With your non-dominant hand, pull the floss down on the facial, release with your PFI, put that instrument down. You now have both hands below facial to the foreone and tighten it. Once it's tight, I would like you to go in again with your mirror and PFI and double check that area. I feel that it's still there, so I'm going to do the same technique. Put that down, tighten, and You're going to triple check just to ensure that. Yep, it's still there. I'm happy with that. Pull down, tighten. Okay, so you triple check that area. It should be very nice and tight. If you don't have it nice and secure, it will loosen on you and ride up the tooth during the procedure. What we want to do then is trim the ligature just so it's out of the way but enough left behind so that you can remove it later. Okay, the ligature is placed. We now want to complete our inversion. So we did the buccal and distal inversions with the floss. The mesial and distal inversions. What we would like to do now is check the buccal and lingual surfaces. Okay, so you can do this visually at first. What we're looking for is that the cuff of the dental dam is in and under. So an uninverted area may look something like that. If you can see the 4-3, you can see how it's just loose there. So if that was the case, we would just choose our air from our air water syringe, stretch it out on the facial, roll air, and slowly release, and it usually inverts. If you're unsuccessful doing it that way and it just will not respond, you may use your PFI, your flat plastic instrument, in the same way. So with your non-dominant hand, stretch the dental dam towards the buccal, slip your starting at the distal, and release your dental dam and roll to the mesial. Okay, I'll show you on the posterior tooth. That's the method. Okay, I'm going to check the lingual aspects, and I'm going to begin with air. We want the least invasive treatment to avoid any tears. Good, that responded quite nicely. I will work on the 4-3 lingual. And I'm just using direct vision, a little bit of indirect with it. Great. Okay, and for completion, you're going to ensure there's no tears. We also want to stretch the dental dam nicely for your operator to have it all nicely prepared. I would say make it look like a nicely made bed sheet, nice and stretched over. Have this floss nicely tucked away. And that is your application of a dental dam from 4-7 to 4-1. Upon completion, we're going to give the client high volume. A rinse with the high volume evacuator. So with the air water in my dominant hand and the high volume evacuator in my non-dominant hand, I will turn on the high volume evacuator, rinse that quadrant, and ensure all the debris is gone. You may give your client a tissue if it happens to splash and just have them hold it in their hand for later. All right, so then we're ready to remove it, the dental dam. So we're going to begin by removing the ligature. Okay, in your restorative cassette, you should have some type of scaler, perhaps. That's what we like to use, and I can use direct vision. What I'm going to be trying to do is slip the scaler underneath the knot that you put in on your ligature, and ensuring that the point of the scaler is away from the tissue, more towards the incisal edge. So fulcruming again is critical. Okay, and sometimes it slips off. That one actually cut with the scaler, and that's okay. So then you get your cotton pliers, and once it's wiggled and removed and you think you can get it with your fingers, that's okay, or you can continue with the cotton pliers. And place that one in the garbage. Okay, your ligature is now removed. You will now require to cut the dam septa from the buckle. Okay, again, the scissors need to be held parallel to the tooth. So if you could just stretch the dam from the facial. The scissors are parallel, ensuring that you are, when you're around the septa, completely cut it, meaning have the tip of the scissors through the entire septa. If you don't and snip it away, similar to that, it makes it very difficult. You have many snips. Like so. If you can cut the septa on the last one, that's great. If you cannot, you would go again to your scaler. Okay, again, fulcruming and with the tip of the scaler underneath or towards the occlusal. I know it's around the entire septa. I'm just going to fulcrum and pull up on that, and it's cut. We now need to loosen the dental dam from the lingual aspect, just to ensure it's out, and it makes the removal a lot smoother. There, it's nice and loose. Now remove the dental dam, clamp, and frame all as a unit. So place your dental dam frame prongs into the holes again. Squeeze open and remove. Okay, I'm going to bring this to the tray. You would tend to your client instantly. Ask, you can dab them. You would give them a full mouth rinse with the saliva ejector. So again, the air water syringe being in your non-dominant hand, this is where we're going to do a full mouth rinse, just for the freshening aspect. And are you okay? Feeling all right? They're going to respond that they are, hopefully. And then you double check your dental dam on a flat surface, so it could be on your hand. And what I'm checking is that your cut is consistent. If you have any voids, you know that you have a missing piece left behind. This one looks okay. That's on a flat surface. You're also going to check the oral cavity and ensure there's no missing pieces. And it looks fantastic. How are you feeling? You're feeling great? That's good. That is how you apply and remove a dental dam from on the lower right quadrant from tooth number 4-7 to 4-1.